The Fourth International Conference on Positive Aging, hosted by the Institute for Social Innovation at Fielding Graduate University, was held recently in Los Angeles at the California Endowment Center for Nonprofit Management. The goal of the conference planners was to explore the ways in which the themes of wellness, community, life transitions, and creativity contribute to positive aging, which involves taking control of one's life, being active in the community, engaging with others, building close relationships, and seeking meaning and purpose. Wellness Plenary speaker June Simmons is a visionary in developing innovative approaches to healthcare delivery. As founding president and CEO of Partners in Care Foundation, Ms. Simmons has been instrumental in creating funding and operating forward-looking health and social services, research, and programs. Dr. Peter Whitehouse, professor of neurology at Case Western Reserve University, introduced Ms. Simmons at the conference.
I'm Peter Whitehouse. I'm the facilitator of the Wellness Tract, and it is my pleasure to introduce June Simmons. I'm a geriatric neurologist who's been saying for years that we ought to pay social workers more and doctors less. June got her social work degree from USC in 1970. I first met her when she was a leader at the Huntington Memorial Hospital and worked together on the National Chronic Care Consortium. She's assumed many leadership positions since that time and is one of the national leaders on integrating social and health models. Currently, she is the CEO and founding CEO. Founding goes a lot with June's biography. She doesn't just lead, she founds Partners in Care Foundation, which emerged out of the VNA in Los Angeles. She's also the head of the Institute for the Advancement of Geriatric Social Work. She's on numerous advisory boards, including the National Institute of Aging Advisory Council. And I tested this line with a few people like Rick Moody. She's an administrator that actually makes you think that administrators don't have to be a dirty word. So I have known the young, wise June Simmons from years ago, and I am looking forward with you to hear the somewhat older, and I suspect wiser, June Simmons talk to us about exploring positive aging. June.
I've been looking at the beautiful use of photography and the spirit of the people present, and some of our team was helping me a little bit think about what to say today, and we agreed you already drank the Kool-Aid. Preaching to the choir is an understatement, I can see, and so you've all figured out that we may be blessed with a much longer life, but that's a good thing, and we're not afraid of it. We're going to celebrate it and make great use of it. However, we notice in our society that many people have not got that message. So I want to talk a little bit about some of the challenges and opportunities in aging, mostly the challenges and what we can do about them at the individual level, little at the community level, and more at the systems level and healthcare and so on. So but what we know is that the message we need to get out in our society, not only about aging, because a lot of the issues I'm going to speak about really are age, not age-linked fully. It's just with the passage of time we see more impact from lifestyle. So I'll be talking about health, which is really very important base for positive aging, as you all know. If we the healthier and more energetic we feel, the better it is for us, the easier it is to enjoy our day. But people do need to work to exercise their choice and adopt healthy lifestyles, and so aging isn't a choice. To some degree we get to, if we're lucky. Healthy aging, positive aging, there's a lot of choices along the way for that. So I know you've all made those choices. Now, how do we inspire and engage others to build a society and a health system that is much more contributory to helping us achieve health, so that they have the freedom to do what it seems your culture for this organization is, to engage in the arts, creative self-expression, some sense of joy. Some people think there's a fountain of youth. Some people think they'll live forever in a perfect state of health. This is actually my dream, is to live quite a long time in a perfect state of health and die in my sleep quickly. But it doesn't always happen. So we have to think, okay, and this fountain of youth is kind of a myth that's floating around for us. And so I think really what we want to talk about are some very fundamental things about healthy lifestyle. This isn't a part of an ad that was in AARP this last issue. And you notice in the lower right here, pill to live past 100, ready in 2 years. I don't know about you, I don't need a pill to do that. I'm planning to do it anyway. How many of you are planning to be good and be 100? Anybody? And have still a nickel in your pocket. Because the life planners know you have to also be ready, because this new lifespan is so much longer than any that we grew up watching, that we have to adjust so many of the aspects of our society and our personal ways of living. But I don't think the pill or the fountain of youth is going to be it. I think there are other opportunities for us. Encore Careers is one, and I don't know, I heard someone's here from Civic Ventures and the Purpose Prize. And so you know, probably a lot of you are eligible to tell your stories or to seek your Encore Career. I'm in mine. Partners in Care Foundation is my Encore Career. And it's risky business, but I recommend it. It's so much fun. It's such a great adventure. So positive aging in many, many ways, filled with so many choices about how we spend ourselves and where we invest our experience, our knowledge, our relationships, and how we turn those into capital for positive change, not so much only for ourselves, but for those around us, for our communities, for the organizations that we enjoy. So I have a question for you. Does anybody know if we're not going to just go to the fountain of youth, but we're going to be the fountain of youth, what the single most powerful health-impacting aspect of life is? What's the one thing, if you did nothing else? Yes? Positive attitude is very good. Yes? Exercise, which gives you a positive attitude. So they go together. You both get the prize. It's true. Physical activity. I was talking with Peter over lunch about the Alzheimer's diseases and related kinds of issues subject to physical activity. Arthritis, subject to almost everything, benefits. And even if one hasn't been exercising, this is something you can restore. So certainly physical activity, number one. And as we all know, easier said than done, to build that into your life in a meaningful way that's fun and allows you to really keep yourself doing it. Proper nutrition and social connectedness, that positive attitude. But medications, of course, are very, very important because, you know, medications can really help you and they can really hurt you. Anybody know anybody that suddenly seemed like way off or like they were tipped, and then it turns out it was the meds? They weren't slipping, tipping. So we have a lot to do about how we manage the health issues that can arise, because any mature object is at risk of some impact from the passage of time and experience. But however we pursue these kinds of things, is say, oh, well, is that all she's going to say? Okay, move around, eat right, you know, be involved. Well, duh. Thank you, June. Nice seeing you. The fact is, doing those things is much harder than knowing those things or telling those things. And so we want to talk a little bit about how we get ourselves to do those things. Because if we don't, of course, what happens is we have these threats. Chronic conditions creep in over time. Our joints and our systems are impacted, but there's so much we can do to prevent that, or to get ourselves back in better shape, or to manage so that the impact of those things is lessened. So I don't know, any of you ever smoke? This is kind of like the healthy crowd, I can't imagine. Yes? Okay. I did, actually. Anybody else want to confess you smoked one? Well, you know, it used to be cool, right? Happily, it's not now. Anyway, that was our number one killer, as you probably know. That and looking at how we eat and increasing our physical activity, very, very important to managing the risks of the passage of time. But as we do those things, they've got to be fun, right? They've got to be like the Silver Lakers. So things like yoga or Tai Chi or walking with your friends. But I saw this, I thought it was kind of fun, and it was part of a report on some research that someone did that found that actually yoga can bring you a better mood-boosting activity. So your positive attitude will be in good shape over there. And you can see all these people are really enjoying it. But the main thing is, I think, to find ways that make it possible to do what we think we should, what we know we should. So what are some of the challenges? So this is like the little, okay, downer part of the things that can come our way. Then we'll move right out of those, okay? So we'll slip by them. But we do have to talk about them a little bit. There are challenges that we face with the passage of time. So one of them is that chronic diseases do have a really increasing prevalence rate over time. And they affect millions of Americans. And they drive costs in our society because we don't handle them very well. We don't prevent them because our healthcare system is paid to help you when you need care. It's not a health system. It's a health care system, and it's paid wrong. It's paid by the piece. So the more care you deliver, the more reimbursement you get. So that's what we're trying to change with the Affordable Care Act. We're trying to move towards health. And so that's a partnership between the resources of medicine and the resources of us. But regardless, we know that right now we have outcomes that are serious. We know that 80% of our health dollar goes towards caring for chronic conditions.